Dr. Sharp Malak with the Breast Imaging Research Program at UAMS is here to clear up some of the questions women may have when it comes to getting mammograms. Thanks for being here.
Yeah, my pleasure. Thanks for having me.
Yeah, so let's talk first about the Mammovan, because what a great opportunity for so many women across the state.
It's really true. A third of the counties in Arkansas do not have a mammographic facility.
Wow.
And so you can see here, this is a map of Arkansas, and every part that is white is a county that doesn't have a mammographic facility. And so what we do is we use one of our two Mammavans to travel across the state to serve those women in those counties that don't have facilities.
That's great. And so is it parked at different places on occasion?
That's right. We partner with primary care physicians, local health centers, community organizations, churches, local health fairs, anything we can do to get to communities where women are not being screened, because we know that screening is the single most important thing a woman can do to prevent a death from breast cancer.
What age do you recommend that those screenings begin?
We save the most lives when women are screened beginning at age 40 and done on a yearly basis.
All right, good to know. And so if you are in that age range, you need to be getting this done every single year?
Absolutely. And let me just show you an example of some different cases. This is a 49-year-old woman who never had a mammogram before, and she presented to us after she felt a mass in her breast, okay? So take a look at the size of that.
Yeah.
It's roughly the size of this mass here, and you can put this in your hand and you can see that. That's the size of a golf ball. Okay?
And she was able to feel that.
And she felt that, and she said, oh, something is wrong, and she came to us for what's called a diagnostic mammogram because she felt something. Now, on the other hand, let me show you this woman who is 42 years old and came for screening. And it's very hard to see the cancer here, but it's this tiny, tiny mass here.
Wow.
And we're able to find it when it's this small instead of this large here. And this small area is something like this. This is probably about smaller than a green pea.
Wow. Yeah, that size comparison is so different.
Absolutely. And it's so important to find cancers when they're small like this, because then they're much less likely to have spread to other parts of the body and take a woman's life.
Wow. And so I know a part of this is the self-exams, people recognizing it themselves. How important is that?
That is important. That is important. But I will tell you, even in the most skilled hands, okay, our ability to find a breast cancer is probably 30 times greater with a screening mammogram than with palpation.
Talk a little bit about the 3D imaging that you guys have, because I find this so interesting.
Yes, so beginning in 2014, UAMS Breast Center started to do 3D mammography. It's called tomosynthesis. It's an enhanced mammogram. And so basically we take several low-dose images of the breast and are able to create like a movie of the breast. And instead of having a flat two-dimensional image, we actually have three-dimensional image, and we can find cancers about 20% better than we do with traditional mammograms. The other good thing about that is we're often able to tell a woman that she's normal without doing additional tests using that 3D mammogram.
That's great. I know for a lot of women that initial mammogram can be a scary thing to go in and get, but it's really not as bad as it's made out to be, right?
It is not. It is an exam that takes less than 15 minutes and really can save your life.
And the 3D imaging, one question I had about it was, okay, so is this some kind of specialty thing? You have to get a regular mammogram first and then the 3D, but not the case.
No, at UAMS we provide 3D mammography for every woman who comes through the door. So it's not a special thing. It's actually become standard of care for us, and soon across the country it will be used as standard of care.
And of course we know the earlier breast cancer is caught, the chances just go up, right?
Your chance of dying from a breast cancer is 40% less if you're screened every year than if you wait until you have a palpable abnormality in the breast. So those are huge odds. And in fact, as I said before, it is the single most important thing that a woman can do to prevent a death from breast cancer is to be screened on a yearly basis.
All right, and I know that Mammovan is something helping so many women across the state, and thank you for being here and for giving us all that information. And to contact the Breast Center, you can just call their phone number, which is there on your screen, the website uamshealth.com, and you can also follow them over on Facebook at UAMS Health. And they post a lot of good information over there as well. Doctor, thank you for being here.
Thank you. you for having me.
Well, when we come back, we're going to fill you in on the latest news this afternoon. Then Heifer Village and Urban Farm is going to join us with details on Alpaca Palooza with some special guests. Stay with us.